Welcome, World Journal readers. My name is Dr. Kalliope Tsirilakis from New York Presbyterian Queens. I am the Director of Pediatric Pulmonary and Asthma at New York Presbyterian Queens, as well as an Assistant Professor of Clinical Pediatrics at Weill Cornell Medical College. Today, we are going to be discussing how to best take control of your child's asthma so that your family can lead a happy life.
欢迎世界日报的读者。今天很荣幸请来纽约长老会皇后医院小儿肺科哮喘科主任医师、威尔康奈尔医学院儿科临床副教授 Dr. Kalliope Tsirilakis。今天我们将讨论如何最好的帮助儿童控制哮喘，让家人过上幸福生活。
Good morning, everyone. I'm Dr. Kalliope Tsirilakis, and today we're going to be discussing your child's asthma, what families need to know.
大家好，今天我们来讨论孩子的哮喘，家人需要了解什么？
So today we're going to be talking all about asthma. We're going to be identifying what is asthma, what are asthma triggers, and how do we treat asthma.
我们今天来讲一下什么是哮喘，什么是诱发因素，而且如何治疗哮喘。
So what is asthma? Asthma is a chronic lung disease. That means that you may have it for most of your life. Asthma is a condition that can cause breathing problems. It can cause breathing problems because the airways of the lungs swell up. This is called inflammation. The muscles around the airways also get tight. This is called bronchoconstriction. Mucus can also build up in the airways of the lungs and clog them up, just like your nose gets clogged when you have a cold.
什么是哮喘？哮喘是一种慢性肺部疾病，这意味着它有可能伴随您的一生大部分的时间。哮喘是一种会导致呼吸困难的疾病问题。如果发生哮喘会导致呼吸问题，是因为肺部气道肿胀，这是一种炎症。气道周围的肌肉变紧，这是因为支气管的收缩。粘液积聚在肺部气道中，并堵塞它们，就像当感冒的时候，鼻子也会被堵塞。
Here are three pictures of lungs, and under the lungs are pictures of airways. If you look at the first picture, the lungs and the airway look healthy. The second picture shows the lungs and an airway that are starting to swell up. The third picture shows the lungs and the muscles around the airways getting tight and the mucus building up and clogging the airway. The airway is much smaller than the airway in the first picture. When you are having breathing problems, you may feel like your chest is tight. You may have a cough, especially at night. You may have shortness of breath or difficulty breathing, or you may have wheezing. We call these things symptoms.
我们可以看到图片是3张肺部的图片，肺部下方的照片是气道。如果您看第一张图片，肺部和气道看起来很健康。第二张图片显示了肺部和气道开始肿胀。第三张图片显示肺部和气道周围的肌肉变得紧张，粘液积聚，并堵塞。而且这个时候气道是比第一个图片中的气道要小得多。当您出现呼吸问题的时候，您可能会感觉胸部变紧、咳嗽，尤其是夜间，呼吸急促，有喘息声，我们称这些东西为症状。
Now let's talk about the things that can make asthma symptoms start an asthma attack. There are many things that can cause someone to have an asthma attack. We call these things triggers. Not all of these things are triggers for everyone. Here are some examples of triggers. Irritants, things that irritate or bother your lungs, like hairspray. Colds and infections. This is the most common trigger for young children and for all people with asthma. Exercise. can make you cough or wheeze if you have exercise-induced asthma. Strong smells like perfumes, cleaning supplies can also be a trigger because they are irritants and have strong smells. Smog and car exhaust. Cigarette smoke is a very important trigger and should be avoided at all times. Mold, especially inside of bathrooms or basements or outside, like wet leaves. Cockroaches, changes in the weather. Furry pets and things with feathers like birds or pillows. Dust and dust mites. Outdoor pollen like trees and grass. Do you know what some of your triggers or your child's triggers may be? Please ask your doctor for help to try to identify what your triggers are so that you can stay away from them.
现在我们来谈谈哪些因素会诱发哮喘。有很多因素可能会导致哮喘攻击，我们称这些因素为诱发因素。但是并非所有的这些诱发因素都会触发每个人的哮喘。刺激物，刺激肺部的物质，比如说发胶。感冒和感染，这是小孩子最常见的诱因。运动，运动有可能会引起咳嗽或喘息。类似香水的强烈气味。清洁用品，它可能成为诱发因素，因为它们具有刺激性且有强烈的气味。烟雾和汽车的废气，香烟的烟雾。霉菌，这会存在于浴室、地下室内外，比如说潮湿的叶子。蟑螂，天气转变。毛茸茸的宠物和带羽毛的东西，比如说鸟，还有一些枕头。灰尘、户外花粉、树木和草丛。您知道哪个是引起您哮喘的诱发因素吗？如果您不大清楚，可以向您的家庭医生去咨询，以远离这些诱发因素。
Now let's talk about the early warning signs of asthma. Warning signs are clues that tell you that your asthma is about to act up or you will get worse soon. These are called asthma symptoms. Asthma symptoms are what you feel when your asthma acts up. Different people have different symptoms. Some symptoms are coughing. Even a little cough is something to treat right away when you have asthma. Also, wheezing. Which is a whistling sound in your chest. A little trouble breathing, chest tightness or chest pain, or a funny feeling in the chest or throat. You can see that the people are starting to have trouble breathing in these pictures. Do you know what your asthma symptoms are?
现在我们来谈一下哮喘的早期预警讯号。警告迹象是告诉您哮喘即将发作，或有可能会变得更糟糕，这些都被称为哮喘症状。哮喘的症状是当您哮喘发作时，您身体的感受。不同的人有不同的症状，一些症状是咳嗽，即使是轻微的咳嗽也需要立即治疗。有些人有喘息，有呼吸困难，胸部紧迫感，胸部或喉咙有奇怪的感觉。您可以看到有些人开始呼吸困难，就像图片上面一样。如果您有哮喘发作时的症状是什么样的呢？
Now let's talk about the different medicines that your doctor may give you to treat an asthma attack and control your asthma. As you can see, there are many different kinds of asthma medicines that are on the market.
现在让我们来谈一下，医生可能会开给您用于治疗哮喘发作和控制哮喘的不同药物。就像图片显示，我们在市场上能看到不同种类的药物。
The first type of medicine we're going to talk about is the medicine that you use when you have asthma symptoms. You can see in the picture that muscles around the airways get tight and the mucus starts to build up and clog the airways when a person is having an asthma attack. If you take your rescue medicine as your doctor told you, and you are getting worse instead of getting better, speak to your doctor right away. If you're feeling like your airways are closing and you are having an asthma attack, or your child is having an asthma attack, you should take your rescue medicine right away, the way that the doctor told you to take it. In the box, you will see that there is a baby taking her rescue medicine with a nebulizer machine. In the other two pictures, you can see that there is an adult as well as a young boy taking their inhaler medicine through a spacer. If you have an inhaler, you should always use a spacer. Rescue medicines are used for just that, rescue during an asthma attack. They work by relaxing the muscles around the airways to make it easier for the air to move in and out. If you stay calm, it can definitely help. And try to do something relaxing while you're waiting for the medicine to work, like reading a book or watching TV.
现在我们讨论一下，当您有哮喘症状出现时使用的第一种药物。您可以看到图片中气道周围的肌肉变得紧张，粘液积聚并堵塞，这是当受到哮喘攻击时呼吸道出现的样子。如果您已经按照医生指示使用了救援药物，但病情没有好转，甚至变得更糟糕，请马上咨询您的家庭医生。依照医生的医嘱使用救援药物。我们可以看到左上角的图片，有一名幼儿正在使用雾化机用药。在图片的中间和右方，您可以看到一名男童和一名成年男士配合着储物罐使用救援药物。救援药物的用途就是在紧急情况下进行哮喘发作的救援。它们的工作原理是放松周围的肌肉，让气管使空气更容易的进出。保持冷静也会有帮助。等待药物发挥作用的时候，我们可以尝试做一些放松的事情，比如说读书或看电视。
So now we're going to talk a little bit about what to do if your asthma keeps getting worse after you've used your rescue medicine. You can call 911 or go to the nearest emergency room right away if any of these things are happening. You can't reach your doctor, or you don't have one and you are getting worse instead of better after you took your rescue medicine. You are having trouble walking or talking, your lips or fingernails are turning blue or gray, or the skin between the ribs or at the neck is pulled in very tight or sucks in. If the patient is a child or baby with asthma, if your child cannot eat, drink, or their crying becomes weaker or in really short bursts, then that is another reason to go to the emergency room.
现在让我们谈一下，如果哮喘持续恶化，如果发生以下情况，请立即拨打911或前往最近的急诊室。如果您无法联系您的医生，或者您没有医生，您在接受救援药物以后，情况变得更糟糕或没有好转，您走路或说话有困难，您的嘴唇或指甲变成蓝色或灰色，您肋骨之间和颈部的皮肤被拉得很紧或凹进去。如果患者是婴儿或儿童，孩子无法进食、饮水或呼声变弱，请马上到急诊室。
There are two kinds of asthma medicines, rescue medicines and controller medicines. We just talked about using a rescue medicine during an asthma attack. Now we're going to talk about controller medicines and why you might need to take them. If you use your rescue medicine more than 2 times a week, or wake up with asthma symptoms more than 2 times a month, or refill your rescue medicine more than 2 times a year, you should speak to your doctor about taking a controller medicine. You may have what is called persistent asthma. In the top picture, you can see an airway that is getting tight and clogged with mucus. In the picture next, we see controller medicines. People with persistent asthma should take controller medicines every day as prescribed by their doctor. Controller medicines take away the swelling and mucus in the airways if you take them every day as the doctor orders. The airway at the bottom shows what can happen when you take your controller medicine. It is a nice open airway that looks very normal. It is important to take controller medicines every day, even when you feel well. Controller medicines do not stop an asthma attack once it starts. Rescue medicines can help treat an asthma attack if you add them to your controller medicines when you are having an asthma attack.
哮喘的药物有2种，救援药物和控制药物。我们之前谈到了受到哮喘攻击期间使用救援药物，现在我们将要讨论一下控制药物，以及我们为什么可能需要使用。如果您每周使用救援药物超过2次，或者每月出现2次以上醒来有哮喘症状，或者每年重配救援药物2次以上，您应该与医生讨论服用控制药物的事宜，因为您可能患有持续性哮喘。我们在上面的图片上可以看到气道变得越来越紧，并且有连叶的堵塞。我们在上面的图片上也看到有不同的控制药物，有持续性哮喘的病人应使用控制药物，按照医生的指示，如果每天使用，可以消除呼吸道的肿胀和粘液。底部的图片我们可以看到，当您使用控制药物时候，气道的状况。即使您感觉身体状况良好，每天使用控制药物也是很重要。一旦哮喘发作，控制药物无法阻止哮喘攻击，但加入急救药物合并使用，可以治疗哮喘。
Everyone with asthma should have a plan for taking control of their asthma. We call this an asthma action plan. Ask your doctor for a written plan so that you know what to do when you are feeling well in the green zone, what to do when you start to have asthma symptoms in the yellow zone, and when you are having an asthma attack in the red zone. The green zone tells you what controller medicine to take every day, even when you are well. The yellow zone tells you how and when to take your rescue medicine if you start having symptoms, and tells you when to call your doctor. The red zone tells you what to do if you already took your rescue medicine and you are getting worse. It also tells you when to call for help. If this is for a child, make sure to bring a copy of the asthma action plan to the child care or to the school.
每个患有哮喘的人都应该有一个计划控制他们的哮喘，我们称之为哮喘行动计划。您可以向医生咨询书面计划，以便知道您在感觉良好的时候，当您出现哮喘症状的时候，而且当您有哮喘发作的时候，您知道怎么样去做。我们看到图片上，绿色区域告诉您，即使您的身体状况很好，您每天应该使用什么药物去控制。黄色区域告诉您，当您哮喘症状出现时，应该如何以及何时使用控制药物和联系您的医生。红色区域告诉您，当您已经使用了救援药物，但情况变得更糟糕，该怎么做？它是可以告诉您何时应寻求帮助。如果是针对儿童的病患，请务必提供一份哮喘行动计划书给托儿所或学校。
Next, we're going to talk a little bit about spacers. Spacers should be used with all inhalers, even for adults, so at all ages. Spacers help to slow down the speed of medicine so that it can actually go into your lungs. It decreases the need for coordinating breathing in and puffing the inhaler, and they are available both with a mouthpiece or a face mask. It is very important that spacers are what we call a one-way valved holding chamber. So it holds the medicine in the chamber so that you can breathe it in slowly.
接下来我们要谈谈储物罐。储物罐应与所有年龄层所用的吸入药物器一起使用。储物罐有助于减慢药物的速度，使其真正进入肺部。它减少了协调呼吸的需要，并且它们都配有咬嘴或面罩。但这必须是单向阀门装置，因为这样才能将药物保持在容器中，以便您可以缓慢地吸入药物。
So why is it important to use a spacer with your inhaler? If you use an inhaler alone without a spacer, the medicine really ends up in the mouth, sticking to the mouth where you see this white light on this picture. It also goes to the throat, the stomach, and a very, very small amount goes to the lungs.
为什么要使用储物罐配合着吸入药物？如果只单独使用吸入药物时，药物只会进入口腔、喉咙、胃和少量到肺部。
If an inhaler is used with a spacer instead, much more of the medicine is delivered to the lungs, as you can see by the white light in this picture.
当吸入器与储物罐一起使用的时候，更多的药物被输送到肺部，就像我们右边图片的显示一样。
Now let's talk a little bit about what to do about your asthma when you are feeling well. When you are feeling well, you should try to stay away from things that make your asthma worse. These are the triggers that we talked about before. In addition, take your controller medicine every day, even when you feel well, as directed by your doctor. A calendar can help remind you to refill your medications every month or whenever they need to be refilled. You can also keep track of your symptoms and visit the doctor every 3 to 6 months, even if you are well. If your child has asthma, you want to tell their teachers, coaches, and school nurse about your child's asthma and what they need to do if they do have an asthma attack. Taking control of asthma can really help improve your life.
现在我们来讲一下，虽然有哮喘，但是身体感觉良好的时候该怎么做？即使身体感觉良好，也尽量远离那些使哮喘恶化的事物。这是我们之前讨论过的诱发因素。即使身体感觉良好，我们也要每天服用控制药物。日历可以帮助提醒您补充药物。即使身体状况良好，没有不适，也需要跟踪症状，并每3到6个月去看医生一次。对于儿童病患，请告诉老师、教练、学校护士，您孩子的哮喘以及受到哮喘攻击时需要做什么。控制哮喘可以帮助改善生活。
If your child has asthma, please make sure that you submit this form, the New York City School Medication Administration Form, to the school at the beginning of the school year or before the school year starts, so that they can use their rescue medicine at school if needed.
如果您的孩子患有哮喘，请确保您在学年开始之前提交纽约市学校药物管理表格，以便他们可以需要时在学校使用急救药物。
In summary, I'd like to leave you with some tips for keeping your asthma under control and helping to prevent asthma attacks. First of all, take your medicines as prescribed by your doctor. Tip number 2, avoid exposures to known triggers. You can monitor pollen counts and air quality levels using an app. Tip number 3, wash your hands frequently with soap for 20 seconds and use hand sanitizer during the day when it is available. And lastly, prevent infections by getting your flu and COVID vaccines and wear your mask to protect against viruses, cold air, high pollen counts, and pollution.
在这里，我想给您一些控制哮喘和预防哮喘发作的建议。首先，我们需要按照医生的处方服药。其次，避免接触已知的诱因，使用应用程式监控花粉数量和空气品质水平。 第三，我们要经常洗手，用肥皂洗手20秒。如果有洗手液，可以在日间并且一起使用。第四，我们可以透过接种流感和新冠疫苗来预防感染，并戴上口罩以抵御病毒、冷空气、高花粉量和污染。
We are here to help you and your child with their asthma at New York Presbyterian Queens. Our New York Presbyterian Queens pediatric asthma team is made up of myself, Dr. Tsirilakis, our allergist, Dr. Perdita Permal, and our certified asthma educator and asthma nurse practitioner, Jennifer Small. If you would like to contact us, you can call the office at 718-670-1920 to schedule an appointment at any one of our practice locations, including in the Teresa Lang Children's Center in the hospital at 5645 Main Street in Flushing, or at the Pediatric Asthma Center at 5916 174th Street, Fresh Meadows.
纽约长老会皇后医院小儿哮喘中心热情为您服务。我们的医生看图片。如果需要联系我们，请拨打718-670-1920。我们在缅街有 Teresa Lang 儿童门诊中心，地址在5645 Main Street 法拉盛11354。我们在新鲜草原区也有小儿哮喘中心，地址在59-16 174街新鲜草原11365。
So we also have the Jackson Heights Family Health Center on Northern Boulevard in Jackson Heights. You can contact the office at the phone number listed here.
我们在杰克逊高地也有普通儿科，电话是718-424-2788。
In addition, we have our pediatric subspecialty practice and general pediatrics at our Fresh Meadows office on Horace Harding Expressway.
我们在新鲜草原也有普通儿科和多个儿童专科门诊服务。
For more information, please contact the Community Health Initiatives at 718-670-1178.
如需更多信息，请联系社区健康发展部，电话718-670-1178。
Thank you for your time, and let's take control of asthma together.
谢谢各位的收看和收听，让我们一起去控制哮喘吧。